Go.
So, this is the last meeting, and we will do part 5.
Okay. So, this says this discussion's around 40 minutes.
Quite long.
And then we do the 10-minute presentation.
Yeah, and I think it's the best because I can only record 40 minutes on this program. Then we discussion, we will end it, I will upload it, and we will do like right after it's the presentation, but that's then a new meeting.
Okay.
Yeah.
So with 2 links at the end, but it's separate.
Yeah.
That sounds good.
Okay, great. And I try to put the articles in the document.
Yeah, we saw
it's
that.
working like how I want it to work. So maybe you can fix
it.
Yeah.
That's okay. Yeah, it looked good.
Great.
All right.
Okay, so
how do we want to go about it? Do you guys want to share your findings and then we can share ours?
Yeah, we have had we thought it was quite difficult. Maybe it's because of it is in English because the question was. Can you do the other one?
Wat?
De opdracht.
Die heb ik niet open.
Oh.
Die heb jij open.
Even opzoeken. Let me check. Right here. Well, we have a discussion, and the only part we thought it was still maybe we discussed it last meeting.
Yeah.
Even kijken. The crisis selected is informed by society and system in which live. Is it correct English? It sounds very weird for me. Maybe it depends on me. But.
Which part?
Part 5. And the students will have an in-depth discussion on how the crisis they selected is informed by society system in which live.
In which they live, I think, is what they meant to say.
Well.
Yeah, so just like how our societies and healthcare systems view the crisis, so like mental health.
Yeah. Well, we both think that the mental health, just like all the mental health, it's like a big taboo on it. I don't know how it's in the US, but we think it's when you like your muscles are hurting or something else, you go to the physio. How do you say it?
Physician.
That one. And when you're like in trouble with your head, it's something
it's hard to...
you're not gonna share. You keep it for yourself. And when you want to get some help, it's most of the time, oh, but you're just a little bit sad. It will be all right. It will be fine. Just wait a few weeks, or it's between the ears. It is between the ears. It's in your head, but like, it's not there. People in the Netherlands are don't be just be normal. Just it's okay. How do you say?
So it's kind of abnormal to seek like psychiatric help in the Netherlands.
Yeah, and it's coming like in the years, but there's still a taboo on it.
I feel like that's kind of how it is here.
Yeah.
It's becoming more like talked about, and like there's more awareness around mental health, but there's still a significant amount of people that don't go seek help because, like you said, you don't present with like physical symptoms. So it's something that they just don't choose to go get further help with. But I feel like for sure in like our schooling and stuff, I feel like it's like generational. There's kind of a gap, like with like our grandparents and stuff, or at least for me, like they grew up like not like you're just fine, go to the doctor and if you're sick, but like mental health is just like not talked about. But they definitely make it like certain that we take a whole course on it. So so I think it's good in that sense, but there's still work to be done. So I feel like we're kind of the same.
Yeah.
Yeah, I was gonna say I feel like within our generation, it's like we're like, of course, go get help. But when you like look at the older generations, they still like with my family at least, like my grandparents and stuff, they're just like, like what's depression? Like that's not a thing, or like like be happy.
And if you not talk about it, it isn't there. Like
yeah, they just get the same education on it as we did, so it makes that gap. So to them it's like not an issue, but to us, like we're way more understanding of it and everything, and it's not as taboo to us, but I can see what the older generations like.
Yeah.
And especially here in like where we live in Minnesota, it like gets like super cold in the winters. So I think a lot of times people just say like it's because of the weather. Like it'll get better when it's warm out, but so I think people like make an excuse for that and just say I'm sad because of the weather, but they don't like take it seriously and go get help that they might need.
Yeah. It's kind of the same over here. Yeah. It's like when the leaves are falling off the trees, then more people getting depressed or sad, or
and the days are getting shorter and the nights
are very dark and everything like that. Oh. And the busy times of Christmas and everything.
Yeah.
But here in the Netherlands, they are like trying to get it more
open,
out in the open. On the TV, there's every day a commercial about it's okay to be not okay. So and
yeah, and I feel like here like a lot is publicized with like celebrities and stuff, and that has to do with like the substance use, and then they overdose and they like all these deaths occur, and they were struggling with mental illness that no one knew about because no one speaks out about it. So I feel like they've done a better job, or I don't know, like the healthcare system I think is I don't know. It's hard. It depends on where you go, because like I've gone to see like psychiatrists and I've had terrible experiences because they are like, well, this isn't wrong with you. Like that's not, you know what I mean? Like they try and tell you, because it's like so hard to say how you're feeling internally when like you don't have a broken arm. You know what I mean?
Yeah.
So it's definitely like when you find someone that's good and understands, it's helpful. And like my family is luckily like very open. Like my mom like is like, if you need to go see a therapist or if you need to go get medication, like do that, because it's not a way to live. And people think that, like how Amber was saying, like seasonal depression, like, oh, it'll get better, but it's like a chemical imbalance, and if it's genetic, like people don't understand that. So I feel like the education needs to be more on that level, because people are like, oh, you're just sad, like go exercise or something. And it's like, it's not that easy, especially when you go down a path for years and don't seek any help. So but yeah, I feel like family history is a huge thing too.
It's true,
because like I know my family has a history of alcoholism and depression, so it's like scary. That's why like I'm like so in tune to like knowing more about it or learning more about it, especially like going into nursing, because it's like very real. And if like a family doesn't have that history, they don't understand it to that sense necessarily. But
I think that too. I think that you only can understand what a depression will do with a family or with a person when you are really close to it.
Yeah, when you're in it.
When you only heard about it, you can imagine.
Yeah.
Or how it will be, what kind of impact it has.
Yeah. This is like a random jaunt off, but what like courses, like what is your class called for this? Is it like families in crisis, or what is this?
This class is like with our mentor,
and we have to combine all the courses in one assignment, in this assignment.
Okay. Yeah. No, because like ours is like, it's like nursing care for families in crisis, and our professor would always say like the more like difficulty you go through, like how you were saying, you understand it when someone close to you or like you went through it, it helps you like empathize as like a nurse more, because you're able to understand like literally what they could be going through. So I feel like we all kind of addressed like family issues that were similar in that sense.
Yeah, I think.
Or you can go ahead.
Go.
Like another thing is like with depression and stuff, it can like we learned how it can cause like physical illnesses if you don't get it treated. So that's like another point to like remember with people, because when you're like, I don't know, just like not okay, it like can cause like stress and like pain and just like all, and turn into actual like physical illness as well. So it's just important to like stay on top of it and just like seek help when it's needed.
And the depression is here in the Netherlands, especially under the younger people, like 18 till 24, 25, is depression and a burnout. So,
but that's the more there's like a kind of hoe zeg je dat, piek?
Right now in the Netherlands, it's everybody needs to do a higher level on school and have a job and have friends and be nice and look good, have a big house and a big car.
The pressure is
so the pressure is really high, and so there's also right now a lot of young people who are having a depression or a burnout because of the high pressure. Because you have to be, and you have to be nice, and you need to have a big house and a good job, and you have to need 3 children or whatever. So that's also here.
And especially that group of young people also start drinking most of the times.
Drugs. It's like there's so much pressure. And then you resort to like the social drinking, and then all of a sudden you're like 30 and it's like maybe not okay anymore, you know what I mean? So it's like really easy to like go down that path, which is scary. By burnout, do you mean like, do you have a lot of like suicides happen at that age?
Not that much, but a lot of people can't work anymore. On a young age, and or even when they are studying, they have a burnout, so they have to put school on hold and need to work on themselves. But then they already got way too far, so it's harder to come back.
I think that's similar here as well, especially like in like the nursing career. It's like really relevant to have like burnout, just because you work so much. I don't know how it is there, but like here it's just like there's such a shortage of nurses, and you're working like.
Yeah, over here it's kind of the same. There's already shortage of nurses, and they want you to do more with less of people, so
and less time.
The pressure in work is getting higher, but it also depends on where you work.
Yeah,
I think.
Yeah.
And I think our generation is kind of used to it already. To have less time for the client, but have to do more administration and everything. But the older generation really struggles with that.
Yeah.
So.
What was I gonna say? You guys mentioned last time we talked or something, like people that get admitted for like a mental health crisis. What do you like call that? Like, or what are like is it like if they're like literally psychotic, not in like a bad term, but you know what I mean? Like, do they just get admitted to like an inpatient place, or how does that work?
I guess it depends, if I understand your question right.
Like, I'm just thinking, because like when we had our mental health clinical rotation, me and Amber were on, it was at like a facility where a lot of like juvenile people went that had mental health issues, but they didn't really have anywhere else to go because many of them had like criminal charges. Yeah, so that was like
crazy for jail, but then be out in the real world.
Yeah, we call it in Dutch. It's called TBS, and
we've got like three departments. You have jail, you have the TBS, and you have a psychiatric facility.
Yeah.
So in the TBS, there are criminals that did horrible things while they were mentally unstable.
Okay.
And are bad to go to jail.
Yeah, and then they
need to get back to society.
Yeah, but they also get a lot of onderzoeken. Yeah? Now, there are a lot of doctors and professors who are gonna check what is wrong with you, why did you do that, were you like normal when you did that, or were you psychotic or something.
And it depends on what they did, if they are unfortunately going back to society, or if they stay in the TBS like for a lifetime, or if they can go home in weekends, or
for one day.
Little steps.
Yeah.
So it's basically made to get them back in society, but if you are really too dangerous and too unstable, then you will be there for the rest of your life.
Yeah. The main goal here in the Netherlands is to get people back in the society. That's where they go for. In jail, in TBS, and in the psychiatric facilities.
Yeah, I was like sad where we had our clinical rotation because, I mean, we had pretty limited interaction with the patients because they just weren't necessarily safe for students to be around. But like many of them like will be there for a very long time, have nowhere else to go, and like clearly it's like depression goes along with it, and then you have like health issues, and it was just like sad that you're just kind of trapped when you're like not mentally right. I mean, I understand that they did something criminally wrong, but it just seemed like almost like morally like not, I don't know, it just was like really hard to see, because it's like if you're schizophrenic or whatever, you know, you need to seek like psychiatric help, and instead they're being like literally like locked in a facility. It was just kind of sad to see. But there's other like hospitals have like mental health inpatient places too. Ours was just like a specific facility for basically criminals. So
yeah, and a lot of the time, like they would get out, but then they'd be back in like a week later. So it's just like they're gonna be there.
Yeah.
So basically, that system around that doesn't work.
Yeah,
no, I think it's messed
like,
up, but
like they were just like focusing on just like basically just like medicating them and to like keep them like calm, but there's no real, from what we saw, there's just like not much done. Like their main focus was just to keep everyone like safe, like the staff and stuff, but they wouldn't take time to like I don't know, we felt like there
needed to be more
done, because
yeah.
like what do you expect from these people who are like in these like little rooms all day, like don't go outside, like they would have to earn like privileges basically to go outside. And I don't know, I could, for someone who's already like psychotic, just having that too, just like being like trapped basically.
Yeah.
Like there's no like light at the end of the tunnel there. It's just kind of a
that's kind of different with here in the Netherlands. Yeah. And here in the Netherlands is also you can live under when someone will like guide you a little bit in the society. So they will work on your mental issues and they will help you, and you can go back in the society, but with a guide, like.
Yeah, I don't know if this is the same, but like group homes or something.
Yeah.
Like people will live like kind of with similar diagnosis or issues, and then they'll all live in the same home with like assistance, which I think is really cool.
Their own house, and then just a guide that will visit them once a week, until that person really can be on his own again.
Yeah.
So there's pretty much work done here with that kind of people.
Yeah.
But also with the higher pressure every year, there's more people that get psychotic or mentally ill.
Yeah.
So there's the placements are too small.
Yeah.
Well,
do you feel like that? Go ahead, Amber.
Our mental health professor was saying, like, she's a nurse practitioner, and she was just saying sometimes she sees patients and they're all like, they all have these problems that need to be addressed, but like there's not room for them in these facilities, so she has to like choose like who she thinks is the most like high prioritized.
Yeah.
You're saying it's like sad because like they all need to be there, but it's like, how do you choose like who needs help more than someone else? It'll just be a really hard position to be in, for me at least.
Yeah, that's true.
Yeah. Over here there are also waiting lists. Yeah. Basically pretty much the same. Only the
you guys have like really good healthcare, I know, but did you say that it's like really expensive to go get? Is it the same for like psychiatric treatment versus like just going to a primary physician?
Yeah, we got like the insurance. You mean that? Yeah, we've got the insurance, and if you are or physically ill or mentally ill, it's all in the same package.
Yeah, that's the other thing I feel like is difficult here is, I mean, there's like so many different plans for insurance and whether you're covered or not, and like people that can't afford regular health insurance probably can't afford to seek mental health or therapy because it's even more expensive. It's like incredibly expensive to go see a therapist if you don't have insurance. So that's like another issue.
They only like cover, depending on your insurance and where you go, it usually just covers like a little bit. Like I've never seen it like fully covered at all. and you need to reach like a certain amount of like your deductible before like it's kind of confusing, but
so a lot of times, or like I've heard people that are like going through a psychotic episode or whatnot will admit themselves to the emergency department because they need help. So like you see a lot of like mental health cases in the emergency room, and it's like expensive on hospital costs because you're treating, you know what I mean? So there's kind of a issue in that measure. I just think, I don't know, our healthcare is pretty complicated, and
like medication is just like a whole different thing.
It's like by yourself also?
It's like your insurance, but it just like again just depends what your plan is. And like for us, like it'll be nice because like healthcare and stuff has very good benefits, but like other people, they need to like pay a lot out of pocket to get their medications and stuff.
Yeah, you have to like qualify if you're like living below poverty level, like not making enough. A lot of times you have to have like children that you can't support. Like that's how you qualify for like somewhat of a healthcare coverage. I don't know enough, but I know enough that it's not
so complicated for us to understand everything.
Yeah, in terms of like psychiatric versus like primary care, there's definitely like a disadvantage. So that makes it hard.
Yeah.
But like our college like offers like free counseling sessions with like therapists on campus.
Yeah.
So that's kind of cool. Like I think you can get like a certain amount of free sessions to meet with like a therapist or a psychiatrist. I don't know. So they promote it for students and stuff, but it's the general population that we worry about too.
Yeah.
But can't solve all the world's problems.
No. We have to start small.
Yeah.
We're trying being a nurse. So.
Yeah.
It's our first step.
Yeah, step one. Yeah, I know our campus also has like a program that if you like put a lime green like bandana on your backpack, it like shows like you're willing to talk to people if they like need help or like feel lost or something.
Yeah.
I don't know how effective it is because it just like started, but it's just like a step in the right direction, just to bring more awareness to the problem.
It's like a statement like saying it's okay to talk about your mental health or acknowledge it.
Yeah, we've got most of the time like a trust
someone you can we call it a trust person, but that's literally translated.
Yeah,
so you can talk to, and
when you got problems you can go to that person and you can talk about everything that's on your mind, how crazy or whatever. That person can advise you and can help you with what you can do. That's basically what we've got. In most of the schools, on work, most of the time there's one person like that.
Yeah, true.
Oh, that's what I was gonna ask. You said, I mean, we have like a lot of pressure. Is there like a high, like does everyone from high school, are you like expected to go on to college in the Netherlands? Or
in the Netherlands, until you're 18, you are basically you must go to school or you get a ticket.
Yeah, you are it's like, how do you say that?
Yeah, leerplichtig.
Yeah, you need to go to school till you're 18th, and then you can figure out if you want it or not.
Yeah.
So, okay. So you're like, once you're like legally allowed to make your own decisions by 18, you can
quit school,
Yeah.
and you can go travel the world or whatever you want.
Do a lot of people, is it like expected that your next step after 18 is go to college, or is it just like some people?
Yeah, and a lot of people are doing like 1 year traveling and then go to college.
Okay.
But that's just what you want.
Yeah.
You can choose all by yourself. But we only have 8 minutes. I can only record 8 minutes.
yeah.
And then I need to upgrade, but then I have to pay and I don't want it.
Okay. So so then we'll record, so we'll stop this soon and then we'll record the 10-minute presentation.
Yeah.
Yes. But when we can stop the recording, then discuss what everybody will say during the presentation and then start to record again.
Okay, perfect.
I have to stop, end meeting, then he will upload it, and then I will open a new meeting.
And then
we can discuss.
And then record.
Okay.
So you get a new link.
All right, perfect.
Yes, I will. Okay. Shall I will stop recording it.
Okay.
Or do you need something to say? Last?
No, I think that was a good discussion.
Okay.
See.
Okay, there we go. Stop recording.